Now, let's introduce the installation and operation process of 980 nanometers 5-in-1 laser therapy device. This is the host, this is the foot switch, and this is the power cord, 110 watts to 220 watts. This is laser glasses, operator to wear. This is ice mask for the customer. This is a fiber optic hand tool. This is a Fungus ring, respectively 0.2 mm, 0.5 mm, 1 mm, 2 mm, 3 mm, adjustable. The Fungus ring is used to adjust the size of the light spot. The thicker and the focus ring is, the larger the light spot. These are two treatment heads for removing red blood. The two are different in shape and are selected according to personal habit when we choose a slight head. This is the onychomycosis physiotherapy head. The 0.2 mm Fungus ring is common used. This is the pain physiotherapy head. This is tender skin anti-inflammatory physiotherapy head. This is eczema herpes physiotherapy head. This is ice compress hammer. Connect the power cord to the power socket, the foot switch to the switch socket, the ice hammer to the ice hammer socket. It can be turned on and used without adding water, and it does not need to be cooled with skill. Now power on. The instrument automatically enters the language selection interface. After loading, there are 6 buttons on the main page. This is Chinese, this is English, this is Russian, this is Spanish, this is Italian, this is Portuguese. Click the corresponding language button to enter the corresponding language. Operation page. For example, click English to enter the English compression page. There are 5 buttons on the page, which are the red blood straight button, physical therapy button, onychomycosis button, skin rejuvenation, and anti-inflammatory button, eczema herpes button. Click the red blood strip button to enter the red blood shot operation page. Click the back button in the standby state to return to the language selection page. The default pulse output of the function of removing red blood. Now click the erythrocyte removal button to enter the erythrocyte removal operation interface. The interface is very simple. There are 3 parameters in total. This is the power, this is the pulse width, this is the frequency. This is the click the plus and less button to adjust the parameters. This is the power. If the value is too small, it will not work. If it is too large, it will cause burn and blizzards. This is the pulse width. The pulse width is the time that the laser stays on the skin. If the value is too small, it will not work. When it is too large, the pain will increase and it will form. The common range is 30 to 60 milliseconds. This is frequency. The frequency is the number of lasers emitted by the laser person. The common range is 2 to 3 Hz. The bulb is aiming light. Click the button to adjust the brightness of aiming light. The first gear is weak, the second gear is brighter, and the third gear is particularly bright. Generally, the first gear is used You can see the red blood. It's too bright, but it's not clear. This is the energy count emitted by the laser after this power on. This is total energy count emitted by this instrument. Click the start button, step the pedal. The laser starts to output and release the pedal to stop the laser's output. If the parameters are not suitable, you need to return to pause state to adjust the increase a little or pathways in increase a little. Click again to start the treatment. This is the operation method of red blood capturing. During pain physiotherapy, click the back button in the standby state to return to the function selection page. Click the pain physiotherapy button to enter the physiotherapy operation interface. Gently unscrew the red blood treatment head. Replace the pain physiotherapy head and do not use focusing ring. The operation method of the interface is same as the interface of removing red blood. When the pain is treated, the power is usually 18 watts or more. The common range of pulse width is between 30 milliseconds to 50 milliseconds. The commonly used frequency range is 5 to 10 Hz. This is the button is the continuous output mode. This is the pulse output mode. Only the pulse mode is needed for the treatment of red blood. CW mode can be selected as needed for pain physiotherapy and onychomycosis removal. In this mode, care must be taken to prevent burns. After continuous mode is started, the pulse width and frequency can no longer be adjusted. Only the power parameters can be adjusted. After a parameters are set, you can operate it. The handle is vertically agent with the part of requiring physiotherapy and distance of about 1 cm and is irradiated in a spinal manner. The physiotherapy part will feel hot. The specific treatment time is not hot and the customer can accept it. In the process of a treatment, the customer should be constantly at about the customer's feeling and the tolerance level. If the parameters are not suitable, release the pedal and click the pulse. The energy is increased a little, or the pulse width increase a little. Click again to start the treatment. This is how the pain physiotherapy works. When removing onychomycosis, click the back button in standby state to return to the function selection page, and then click on onychomycosis removal button to enter the onychomycosis operation page, and replace the onychomycosis treatment head with a 0.2 mm focusing ring. The power is usually 12 watts and above. The pulse width is usually in the range of 20 milliseconds to 40 milliseconds, and the frequency is usually in the range of 2 to 3 Hz. The handles are aimed at thick nails that need to be irradiated, and the nails feel hot when they are irradiated in spiral manner. The specific treatment time is based on the temperature and the customer can accept it. During the treatment process, the customer's feeling must be contact us. Tolerability degree. This is how to get rid of onychomycosis. When skin rejuvenation and anti-inflammatory, click the back button in the standby state to return to the function selection page, and then click the skin rejuvenation and anti-inflammatory button to enter the skin rejuvenation and anti-inflammatory operation page. It is recommended to start the operation of 12 watts. If there is no sensation, the energy can be increased little by little. Generally, 12 watts to 20 watts is more suitable. The common range of pulse width is 10 to 20 milliseconds, and the common range of frequency is 10 to 30 Hz. The treatment head irradiated to skin vertically about 5 to 8 centimeters away from the skin, and skin feels slightly warm after about 6 seconds of irradiation. The duration of infiltration and the length of treatment are determined by doctor according to the individual treatment range and depth. It is recommended that each area be treated no longer than 3 minutes. The intervention period is recommended 1 to 2 times a week. This is how to rejuvenate and reduce inflammation. When treating eczema herpes, click the back button to return to the function selection page in the standby state, and then click the eczema and herpes button to enter the operation mode of eczema and herpes. Change to the eczema herpes physiotherapy head without focusing ring. The power is usually 12 watts and above. The pulse width is usually in range of 80 milliseconds to 90 milliseconds, and the frequency is usually in the range of 6 to 7 Hz. If there is no feeling, you can increase the energy little by little. The treatment head is vertically radiated 2 to 3 centimeters away from the skin. It is better to feel a slight warmth after about 5 seconds of irradiation. The irradiation time and the length of treatment are determined by doctor according to the individual treatment range and depth. 10 to 20 minutes, 6 days as a course of treatment, 2-day intermediate course of treatment, heal and stop treatment. This is how to treat eczema herpes. When a cold compress is needed to cool down, use an ice compress hammer. The ice compress hammer can be used immediately after the instrument is turned on. It has nothing to do with the screen program. Long press the switch on the ice compress hammer to turn on the ice pack function. The longer the use time, the lower the surface temperature of ice compress hammer. Adjust its appropriately according to the specific situation. The time should not be over long. If the patient is found to have adverse reactions, it should be stopped immediately to prevent frostbite. This is how the ice compress hammer works.